Again, thank you for taking time to join us today to learn more about the work that we're doing. So there's been a tremendous amount of work, and you're going to continue to get additional information as it becomes available. One of the things that we're very fortunate to have is being located in a community and in a county that has taken this pandemic quite seriously, and that's reflected in our health policies here locally and in the ones that are on campus. And as a result of that, things like face coverings and physical distancing and limiting sizes of groups and so forth, as a result of those kinds of strategies, the prevalence rate here in Dane County has remained relatively low, and certainly considerably less than what it is in other parts of the state and country. Right now, as the 7-day average positivity test is about 1.7%. And the number of tests, the positive tests that happen, continue to decline on a daily basis. You may be aware, hopefully are aware, that we have already opened up on-campus testing. We know that access to testing is critical, so that any individual, whether you're faculty or staff or student, that you can, if you have the need or feel the need to be tested, you can go easily get tested and get those results back in a quick turnaround time. So on August 6th, we opened up the Henry Mall location, which is now both a walk-up and a drive-through location, and individuals are taking advantage of that. And our early testing results are actually lining up very much with the prevalence we're seeing in the community. So we're encouraged by that. In order to make a test, we'd ask that you go to your MyUHS portal. And you can pre-register and sign electronic consent in advance of going there. And then if you show up during the time that you're scheduled to be there, you will spend just minutes at that site and be able to move about your way. Because the testing is being collected on campus and processed locally, we are getting the results back within 24 to 36 hours in most cases. And because of that, we will be able to notify the individuals about those test results very quickly through a secure message or a direct phone call. So if you get any contacts from UHS, it's important that you respond to those quickly. The second testing site was scheduled to open sometime next week at the Fluno location, and then we have a third testing site if the demand is needed to also expand that capacity. So we feel very confident in our ability to provide ready access to testing. There's no cost for that, and there's no limit on the test that you can take advantage of. We want to be sure that if you need a test, that you get a test. Also, what's really important with that is the contact tracing work that is necessary to go on. So UHS and the campus have been working with the public health department here in Madison-Dane County to coordinate and support the public health contact tracing mission. And so we have actually trained staff in collaboration with them and continue to add additional staff every week. And we literally have dozens of staff that their focus is now to support that public health, that contact tracing mission, so that if we do identify a positive case, that we have folks that can quickly identify who may have been considered a close contact and support them and get everybody in the right situation so that they can successfully navigate that experience. In addition to that, we also have well-developed isolation and quarantine protocols. The campus is identified a substantial number of spaces that, if we need to, we can relocate students who reside on campus to a quarantine or an isolation space to support them during that period of time. So a lot of information, of course, is available online. If one of our students is identified that way, they will be quickly relocated to one of these facilities, and then there will be regular oversight and support for them during that period of time, whether it's food or support services or medical oversight during that period of time. So we feel, again, well prepared to respond to that demand should it occur. We also have strong protocols around notifying the appropriate parties on campus about positive test results. As a faculty member, if there's a student in your class that tests positive, you will receive a notification that somebody tested positive. You won't necessarily receive information about that person's identity because of confidentiality, but that student will also be directly contacted and encouraged to reach out to their faculty and their advisors to let them know what's going on, and provided documentation to support their need to be away from the classroom for a period of time. If you're an employee, your divisional disability representative in your unit will also receive notification so that they can support you as needed as well. And then the environmental health and safety team here with Alan Fish's shop are also will be notified and take any necessary measures there where maintenance is or cleaning is indicated. We also have a self-reporting expectation that's established for employees and staff. So if you get tested someplace off campus and you get those test results, we'd ask that you share that with us so we can support you and that contact tracing and public health mission as well. If you get tested on campus, you don't need to self-report. We'll already receive that information and likely we'll have shared it with you ourselves. So there's a number of other protocols around supporting students and faculty and staff success during this period of time, and we just encourage you to take a look at those.